Health officials are continuing to step up efforts to keep the Zika virus at bay, but there are reports that the virus continues to spread.
Tonight, our Janelle Noel Ferguson tells us that the number has increased.
Another Zika case confirmed overnight, prompting health officials to meet early Friday morning in high-level talks to assess the growing Zika situation. That meeting, held at the Ministry of Health on Meeting Street, was, however, interrupted due to a fire alarm. Now, after staff headed out of the building, we were able to learn more from senior medical official Merciana Moxie, in charge of the surveillance unit, on the newly detected case.
Overnight, we can confirm another case of Zika. It's in a 46-year-old gentleman who lives in the southwestern part of the island of New Providence.
And according to Moxie, more confirmed cases of the virus is expected.
Yes, we can expect more cases to come about. We are awaiting results now from our regional reference laboratory. And as soon as we get those results, whatever they are, they will be made public.
Health Minister Dr. Perry Gomez also addressing the issue.
The real enemy is the mosquito, okay, and we must control the mosquito. And so that's why we've been encouraging people around the country to clean up their yards, avoiding areas where water can pool, which predisposes to the growth of the mosquito.
Now, in South Florida, there is a growing concern about the chemicals being used to combat the Aedes aegypti mosquito. However, Health Minister Dr. Gomez said that's not an immediate concern for us at this time.
You know, you have to use the chemicals to kill the mosquito, and then deal with the next problem after that, if the problem arises. You know, every medicine has a side effect, and so it's not surprising that the medicine against the mosquito has side effects too. And so, but we have to do what is pertinent at this point in time.
Those side effects, are they life-threatening?
Not that I know, no. They're not life-threatening, no.
Meanwhile, health officials are particularly concerned about pregnant women being bitten or contracting the disease through sexual intercourse. Gomez reminded that it can lead to microcephaly, or babies being born with small heads. He said they're working closely with doctors in this regard.
With antenatal care, you know, that we are very cognizant of that, and so that's covered.
So there's nothing that one can do if they're already infected in terms of that fetus? There's nothing they can do at that point?
Not really, no. There's no intervention at this time for someone who is already, who's in pregnancy and turns out to be positive.
Residents, especially those in New Providence, are reminded to wear long-sleeve, light-colored clothing, use DEET-containing repellent, turn over containers that can hold settled water, and use condoms during sexual intercourse. Janelle Noel Ferguson, ZNS Network News.